An HSA works when an employer sets up a plan and is going to be able to reimburse their employees for their health and dental bills tax-free. So that plan setup requires the employer to set classifications and limits. You can have one class, which would be the same limit for all employees, or you can have multiple classes with different limits for different employees. So some employers might set up a plan for, let's say, sales or administration or technical, or maybe they might just keep it simple and have one class full-time employees. If they put part-time employees on, they might have one class part-time, but the same limit for everybody. One other thing that the employer can do is they can distinguish by family and single. Some like to provide more dollars for a family employee than a single employee, so you could have full-time family, full-time single, and a different limit, and then you're just slotting your employees into those classifications. They'll see their annual limit. They'll be able to claim up to that amount for themselves and their family dependents' health and dental bills.